federal regulation, just a federal agency can issue a regulation, and that wipes out or supersedes the state constitution or state law. When they tell you that there's nothing, here's their statement that's accurate on its face, but it's a lawyer lie. There's nothing in the bill that overturns state medical malpractice caps. There's nothing in the bill that overturns Texas's tort reform. Oh, and there's nothing in the bill that overturns the prohibition against using federal dollars for abortion. It's a lawyer lie. But what they've done is create a super agency that's called, there's 111 different federal agencies created in this thing. Like we need more agencies. There's already more termite mounds in this city consuming the Constitution than I can count. Which one is the super powerful, omnipotent Wizard of Oz behind the curtain?
The Federal Health Advisory Board.
The Federal Health Advisory Board. That's the one that'll also write the rules about grandma gets cut off at some point. When you get your health care cut off, you know, you've really had a good life. You know, there's a lot of young people that need it.
And referred to as the death panels?
They'll be able, well, they'll issue rules and guidelines on what you want to look for is comparative effectiveness. We're going to design rules, this omnipotent authority that, of course, is a lot smarter than the rest of us, mere, you know, slobs, are going to issue rules that say, that lay out the comparative effectiveness of different medical procedures. And a guy like me that just turned over 50, you know, if I get my knee just went bad, I always wondered what would fail first. This knee went bad. And at some point when the parts start failing, you know, and you get a little older, you know, you've just had a good life. And the comparative effectiveness of the taxpayers providing that health care to you, John, at, you know, you hit 60 and 65 and you've had a good life, and there's lots of young people that need this, and money's tight. You know, we have to measure the comparative effectiveness of providing you this care versus some healthy, young, robust person. Now, this is actually being done in Denmark and in Holland. They actually have a committee of doctors.
This is what this board is going to decide.
Absolutely. They're going to design rules for comparative effectiveness, and watch out when you hear comparative effectiveness, that's what they're talking about. And then this super board will also have the authority, because under the bill, this is the sneaky part I was telling you about, for example, on overturning Texas's medical malpractice protection, the abortion prohibition against using tax dollars for abortion, anything you can think of, because the bill says this super board has plenary power, has to do whatever is necessary to carry out the provisions of the bill. They can issue a regulation to, for example, say that the Texas medical malpractice caps no longer apply. And it's valid, and that overturns it, and they did it by regulation, and they never had to pass a bill. And Gene Green and all of them can look you in the eye and say, we didn't do it, the agency did it. There's nothing, and they can issue regulation that says tax dollars can be used for abortion.